Great presentation today. We're going to look at about the winter swimming and how does it help in the health conditions and all that. Again, my name is Pramil. Cheriyath. I'm a director in research, program director in internal medicine, transitional residency. I teach medical students and residents. And so let's get into our subject. A lot of information is coming out winter swimming. A lot of people are doing it, especially in the Europe in the winter time. They go into the cold, frigid, icy water and then swim, and previous studies have shown significant health benefit in those people. Okay, but this is not for everyone. Please make sure you have to train yourself before you or check with your doctor to make sure conditions and everything, you don't have any other medical condition. So we don't recommend this unless you have a complete clearance from the doctor and be trained for it. I always in the morning I take cold shower. I've been doing that for the past 4 or 5 years, and I did see an improvement. Okay, let's get in. So what is the physiology? When you are entering cold water, immediately cooled and sensed by the cold receptors very close to the Sin's curvature, right? Initially, you can have initial gas followed by rapid uncontrollable breathing and then increase in the heart rate, blood pressure. So they call this like cold shock syndrome. So what does it do? The benefit: boost the immune system. Cold water helps boost the white blood cell count because the body is forced to react to changing conditions, okay? Then improve your circulation, flushes your veins, arteries, and capillaries. Increase libido, dip in the cold water, boost estrogen and testosterone levels also, burn calories. Heart has to pump faster in cold water. And the body must work hard to keep everything warm while swimming. That helps in reduce stress. Cold water places stress on the body physically and mentally and help with the stress. So we find this great scientific study improves oxidative protection in the winter swimmers, okay? Objective aim of the present study was to investigate whether the repeated oxidative stress in the winter swimmers results in improved anti-oxidative adaptation, which could lead to clinical benefit. So is there any, what happens in the winter swimming? That's the main purpose of the study. So method, the members, they have this club with people swimming in the winter. They were swimming at least once per week during the whole cold season, and about 5 minutes, never longer than 10 minutes, and we collected the blood sample, measurement of the GSH, glutathione, hydroxynonial, and other biochemical measurements. So what is glutathione? Okay, glutathione acts in reduced and an oxidative state. The ratio, reduced glutathione and oxidated glutathione within the cell is a measure of cellular oxidative stress where increased GSSC to GSH ratio is indicative of greater oxidative stress. Okay, in healthy tissue, more than 90% of the total glutathione pools in the reduced form, while the remainder of the dicyl form in the dicyl form. Remember that. In healthy, if you're healthy, 90% of the total glutathione is in the reduced form, and it protects the cell by neutralizing reactive oxygen species. And glutathione also employed in like a detoxification, methoxyglycoxyl and formaldehyde. Okay, so here clearly this shown as like the levels. The glutathione oxidized and reduced ratio is extremely less in these people. So initially there is some mild oxidative stress, so the body protects. So that's probably explain all the health benefits. So based on this study, all the chemical reaction and all that, it's an excellent scientific study. So a lot of benefit is expected in the winter swimmers because there's mild repeated oxidative stress, and it's a new basic molecular mechanism and increased tolerance to environmental stress and cause of all this protective health benefits for the patient. Thank you so much for watching. We'll be back with another presentation soon. Thank you.